In the quiet English town of Hyde, everyone trusted their doctor. Dr. Harold Shipman, soft-spoken, polite, and always ready to visit patients in their homes, was the kind of physician every family wished for. To the elderly, he was a guardian angel. To their children, he was comfort and reassurance. But behind the warmth of his white coat lived a darkness no one could see. Harold Frederick Shipman was born in Nottingham in 1946. He was bright, disciplined, and admired by his teachers. But when his mother fell ill with cancer, the teenage Harold watched her slowly fade away, comforted only by the morphine injections given by her doctor. Those moments would mark him forever. He went on to study medicine at Leeds University, determined to become the kind of doctor who could ease suffering. But soon, something went wrong. By his early 30s, Shipman had developed a secret addiction to pethidine, a powerful painkiller. He forged prescriptions for himself and was caught in 1975, fined, and briefly sent for rehabilitation. Yet he returned to work, his reputation quietly repaired, his dark side overlooked. Years later, in Hyde, Shipman built a thriving practice. He was respected, even loved. His patients, mostly elderly women, trusted him so deeply they'd open their doors without question. He would visit, often unannounced, carrying his medical bag. Minutes after he left, a family member would find the patient, peaceful, eyes closed, gone. Natural causes, Shipman would write on the certificate. He'd console the families, offer kind words, and sign the cremation papers. No one suspected a thing, but behind the gentle smile, he was administering lethal doses of diamorphine, the same drug he'd seen used on his dying mother. He watched as life slipped away, calmly, almost proudly. To him it seemed, death was mercy, or maybe it was control. For over 20 years, the deaths continued, silent, unnoticed. Until one day in 1998, Shipman made a mistake. His final victim, Kathleen Grundy, was an 81-year-old former mayor, healthy, cheerful, and wealthy. When she died unexpectedly, Shipman told her family it was old age. But her daughter, Angela Woodruff, a lawyer, received a shocking document, a will leaving £386,000 to Dr. Shipman. Angela knew her mother would never do that. She looked closely. The will was typed, and the signature was clumsy. She called the police. Investigators exhumed Kathleen's body. Toxicology reports revealed a fatal dose of heroin in her system. The evidence pointed straight to Dr. Shipmate. Police began digging deeper into his patient records, death certificates, and cremation forms. They found patterns,